and you can take it away, Mike.
Thank you. I just have one question for you. Is there a way to get this toolbar off the top of my screen? Do you know? Like it says mute, stop video, participants, chat, news share. Is there a way to hide this thing?
Oh, I can't see it myself.
Let's see.
I don't know if maybe it's in the way from your.
Yeah, it's just in a way. It's just, let's see if I can.
I don't think I can control that though.
Okay, so I'll play with it. If you see me stop talking, it's because I'm moving this toolbar thingy around that's like in the middle of the presentation. So
all right, no problems. That's okay.
Okay, so let's start this party and get it going. And
yeah,
who has questions? So I do PowerPoint's a little different. If somebody has a question, they could just ask during the time of the slide versus at the end. So, but my name is Mike Maniosi, and I am a community engagement program manager with Excellus. And today we are going to do a short presentation about health insurance, important, what's covered, the different plan selections, and so much more. So let me get this thing rolling. Hopefully this works. Let's see. All right, didn't work. Hold on. Let's try this again. All right, perfect. Oh, now I see. Hang on, I gotta move my thingies around because now I see all of us. All right. So here's the agenda for today. Meet and greet. So kind of who I am, what I do. My role at Excellus is I am the person who comes into a business or agency or school district, and I explain who we are, what we do, and how we can help across the board from many phases, and not just a health insurance standpoint. So this is our mission and our vision. So our mission is to help people in our communities live a healthier and more secure life through access to high quality, affordable healthcare.
Do you have a slide for that? Because I don't think it changed.
Oh, so on my screen, it shows our mission and vision. What do you see?
We see the title slide, the first slide.
Oh, wonder why why did I stop sharing maybe? No, it says your screen is being, my screen is paused. How do I unpause my screen?
That's a great question.
I've never had this happen before, so I'm not sure. I'm gonna, let's see, how's this? Did it work?
Yeah, now we can see it. You're on slide 4.
Okay, let's see. Let's go back to this one. Let me try it. Hang on a second for me.
Perfect. Yeah.
F5 and make it bigger. So can you guys see this?
Yep, it comes back to the first slide. There we go.
Second slide. One. So third, yep. We're good?
Yep.
Okay, I must have paused it when I was trying to move the toolbar around because it's like a giant toolbar at the bottom of the screen. So, so I apologize, but I'll pick up. So our vision is to be recognized and valued as the community and business resource for healthcare security through financial strength, effective cost control, ease of use, and commitment to health improvement. So really what that means is we want to make sure everyone lives a healthy life and everyone has the care that they need. You know, when you hear health insurance or a health plan, most times it's recognized as just health insurance, but what we do behind the scenes is so much more. So, and I'll touch on that through this PowerPoint. Did that work? You can see this still, right? Okay, so I'm gonna ask that because I don't know if you can or can't see it. So this slide is why is health insurance important and why is it needed? No one plans to get sick or hurt, and most people need medical care at some point. And what health insurance really does is it covers the costs and offers many other benefits. So if you go to the doctors, if you have to go to emergency, that's really key on why you need health insurance. It helps the cost, it helps you and give you the coverage you need from being sick. or injured or something happens. So health insurance, again, it protects you from unexpected high medical costs. You pay less for covered and network healthcare even before you meet your deductible. In your situation or this situation with people who come from different countries, you're automatically enrolled in what's called Medicaid. And that's one of the plans I'll discuss. But with Medicaid, you really have no costs. The only dilemma you could run into, depending on how you got your insurance, is if you have a managed care plan or emergency Medicaid. Most times when somebody comes to the United States or to the country, they have what's called emergency Medicaid. And that is really only allows you to see the hospital. Managed care is more of a plan. So a plan will be Excellus, MVP, United, things like that. But I'm going to go over the marketplace now and kind of dive deeper into this whole process and how it works. So the marketplace is known as, there's so many different names for it. They call it the Health Insurance Exchange, Department of Health. They call it Obamacare. You may hear different terms when you're out there. Really, what the marketplace is, it's a one nonstop shop for different health plans from different carriers that you can shop for and see and compare and contrast what's out there. The marketplace was established in 2013, and what it does is it helps you just review, compare, see what's out there, what's available. If you're somebody who is unemployed or just moved to the country, this is the place you'll want to go to. You can go to what's called Department of Social Services to get coverage. Sometimes, a lot of times, this is a lot faster for somebody to go through than to go through DHS versus the marketplace. So what makes somebody qualified for health insurance in New York State? You have to be a New York State resident. You have to fall under the poverty levels of the income guidelines. So everything through this whole process is based on household size, income, and that's really what covers this. So that's what makes somebody eligible. But a lot of it plays into age. If you're somebody who is, let's say, over 65, you won't qualify for this process. You'll be somebody who's eligible for Medicare versus Medicaid. So this process is meant for anyone from newborn to 65 or up to 65.
Was that the qualification criteria just for Medicaid, or is this just for
across the board? This is what they look for when you come here. Okay. So let's say you're somebody from another country and you have a green card. So what they'll do is they'll want to identity proof you. So what I would do is say, okay, do you have your, I-94 or your green card or whatever you came with you? And then what they'll do is they'll give them coverage based on what they have. So in order to get Medicaid, for example, you need to follow these guidelines. If you're somebody from another country moving in here, they may not give you Medicaid, but they'll give you what's called the Essential Plan. It's just another name. It mirrors Medicaid to a T. So all of the coverage is the same. It's just the Essential Plan is more geared towards somebody that's not yet a resident of New York State. And I move my thingies around, so bear with me because I don't know how to okay. Hopefully I don't pause anybody. So, but I'll just go off this slide, sorry. So again, these safety net products are what I work in and what the other facilitators and rollers work with. And how it works is if you're a New York resident, if you're from birth to age 18, you're eligible for Medicaid or Child Health Plus. And Child Health Plus is another plan that we offer, that all the plans offer. But in order to get that, you have to be higher than the poverty level for Medicaid. That'll be the next plan for somebody who falls in that age range. And then when let's say you're 18 and you turn 19, usually you're eligible for the other side of the plans. And I see Medicaid's written twice, meaning you can still continue to have your Medicaid up until 64 based on your income and your household size. But once you turn 19, you're eligible for the other plans listed below. So Health and Recovery, which is HARP, or the Essential Plan. The Essential Plan part would be if you made too much for Medicaid, you move into the Essential Plan, which will be the next tier up. And again, this is all based on income and household size. And some cute little babies and families. And so this is Child Health Plus. This is the criteria and what makes you eligible. So it's anyone from 0 to 19 is eligible for Child Health Plus. You must be a New York State resident. Your eligibility is determined by New York State of Health. So that would be the marketplace. They're the ones that would determine what you're eligible for based on, again, on your income and household size. It's available to lower income people who don't qualify for Medicaid, but have no other comprehensive health insurance, meaning sometimes you may work for an employer who doesn't really offer insurance and you're not sure how to get your child covered. This is another option. And these guidelines down here are just the figures of how it calculates to what you'll pay per month per premium. What's good about Child Health Plus is there's no deductibles, there's no co-pays, you don't pay anything. It is a great insurance plan for kids who need health insurance. And why can I move my presentation is not working now? Oh, there we go. You can still see that, right? I'm sorry, I have to ask this because it's slow on my end.
We can see it over here.
Okay, so what are the benefits to Child Health Plus? Again, no deductibles, no co-pays. Larger families, the fees capped at 3. So if you have a family of 4 or 5, you only pay for the first 3 children. And so a deductible, what that is if you have a plan through an employer, a lot of times you'll have to meet your deductible before your insurance starts. It means that you're paying out of pocket for your visit. And this plan with children, you don't do that. So everything's covered, your medical checkups, your doctor visits, your clinics, your shots, your x-rays, eye care, glasses, dental, anything you can think of is covered. The only thing that they just recently stopped covering, which by the way is awful, is braces. They used to cover them for children. They don't do that any longer. So if you need braces, that's something you would have to explore outside of this kind of plan. The Essential Plan, this is a newer plan that New York State just created. And the reason why they made this plan was they realized there was a gap in coverage and a gap with people needing health insurance. It's either they made too much for Medicaid, but couldn't afford what's called a qualified health plan. So the state kind of figured a plan out that would be substantial for everyone else, the people that fall in between. So this is the criteria for the Essential Plan. It's for anyone that's 19 to 64 years of age. You must be a New York State resident. Again, eligibility is all determined by New York State Health, and it's available to lower income people who don't qualify for Medicaid. So again, based on household size, based on income is when and how the state will determine what you're eligible for. And below it explains the breakdown of the percentages. Now, this too just changed. Actually, it literally just changed. So because of the coronavirus and COVID, there used to be a monthly fee for your health insurance if you had the essential plan. But because of the virus, they have waived all the monthly fees. So it's free insurance, which is great. And this kind of shows the benefits and coverage of what this plan covers. So the essential plan, excuse me, is known for what New York State calls the 10 essential benefits and what's needed in a health plan. So on the right-hand side, well, my right-hand side, it breaks it down. So what's covered? Maternity care, rehab services, pediatric services, your prescriptions, lab results, your checkups are all covered, emergency visits. I actually have this plan for myself. So it is an amazing plan. It's fantastic if you get this plan, because what's covered and what you pay, which is really nothing, it's such a relief. The other thing too with these plans, because of the coronavirus, dental and vision used to be separate, and now they have included it in one bundle. So again, the essential plan is free, and it now also includes dental and vision. And this is just talking about the changes that I just mentioned. So this is my favorite plan. If you can get Medicaid, take it and run with it. It is the best insurance plan that one person can ever enroll into, because it just helps so many people, and it helps them with so much, struggles that somebody might have. But again, Medicaid, to be eligible, it covers, if you're a population that includes children, pregnant women, single individuals, families that are blind or disabled. That's one of the criteria that will automatically get you Medicaid. So if you're somebody who's pregnant and you're not sure what to do for health insurance, this is the plan that will give you through the state. And this is a plan that you'll never have to worry about anything. Every single thing is covered when you have Medicaid. Persons who live with medical bills may be eligible even if it's above the allowable income. So they do take into account certain things if you make too much for Medicaid. The biggest thing, you have to be a New York State resident. And again, all the eligibility is determined by New York State of Health. Pregnant women, services may be limited if incomes are too high. This also changed too. Again, all this just literally rolled out. Actually, not too, maybe a day after I sent you the presentation, just so we're on the same page. Because of the new year, we're opening open enrollment. All this stuff is changing right now. And so our Medicaid plan is available in 13 counties, but we plan to expand to different areas of New York State. And again, below are just the guidelines for the percentages for somebody who qualifies for Medicaid. One of the great things about Medicaid is, and many people don't know this, is Medicaid and the essential plan, they both go based off your last 4 weeks of income. So what that means is if you're somebody who works a full-time job for 8 months of the year, and all of a sudden you're terminated, you quit, you lose your job, whatever the case is, what we would do is it would ask you for a separation letter from your employer or a termination letter. And what we would do is we would do an application for you and get you approved for Medicaid, so you have coverage. So if there's something that happens in the future, you know that you have health insurance and you don't have to worry about it. And again, this is just breaks down what's covered under Medicaid. So all your regular medical checkups, family planning services, doctor health clinics, your medical supplies, medical equipment, lab tests and x-rays, glasses, dental, emergency care, hospital visits, nursing home. So there's a lot that this covers. It covers everything one person can ever need. So is there any questions so far?
Is there anybody that's using any of these plans that you can just speak to the experience about, or if you have Excellus, or if you're looking to get a plan or change plans, or any other questions? And if not, that's okay too.
No, it works. A lot of times when we do these presentations or we're on site somewhere, sometimes we realize that some people don't want to come forward about their health insurance situation.
Yeah, of course.
Contact information is at the end. So
yeah.
If anybody has questions, they want to set up a time to meet and talk, I'm more than available to do that.
Yeah, that's good to know. That's very true.
All right. So this is just a breakdown of what our safety net products are. Again, I just went over these plans, but this is just a different slide to kind of just show what each one is in a different scale. So essential plan, why is it so great? There's a zero premium. It covers vision, dental, and you're eligible for these plans all year long. So you may hear the term open enrollment, which is like what this is right now, and what a lot of people go through when they're at work. So these plans are available all year long. Even though we're in open enrollment right now for these plans, what that means is when we're in open enrollment, it allows you to change your plans. So let's say, for example, you're somebody who just came here or did your insurance with another plan, we'll just say Fidelis or MVP, and you realize you want to see Dr. Bob, but Dr. Bob's not in their network, meaning you can't see them because he doesn't take your insurance, but he takes Excellus or another plan. During open enrollment, you're allowed to change your plans to then be able to see the doctor you want to see. That's why when we talk to clients and when we help them, one of the things that we'll ask you for is, do you have a list of doctors that you want to see? Because we want to make sure that they're a network for you. And Excellus is in 99% of all the networks. So there's not a place that probably doesn't take us unless it's outside or it's private. But I mean, we're everywhere. So if you ever, like I said, you have questions about your doctors, there's a slide that's coming up that will kind of break down how to search for your doctor. And what's going on? Okay. I feel like I may have skipped a slide though, because for some reason it's not letting me kind of get past it. So I just want to see one. Okay.
Yeah.
Just want to make sure. Sorry, guys. And for some reason, I've been having such terrible internet connection where I live.
Oh, okay.
Green light
That's
just
okay. You can't control that.
And this, yes, thanks. Green light just moved into the area, so it's like my internet is like super slow.
Yeah.
So I don't know if that's what it is, but now I'm going to talk to you about what is called MFE, which is a marketplace facilitator and enroller. That is the people that are on the team with me. And what they do is they're the people who you will meet with that would do the application for you. They would collect all the information. They would create you an account through New York State. They're the people that will really help you through the whole enrollment process to make sure that you have the coverage and the care that you need. And the reason why people see MFEs or facilitator enrollers is there are less chances of errors. They're really familiar with all the processes, the rules, the laws, things like that. They're able to give you more accurate eligibility determination. We're constantly trained every month by New York State on it. And it takes us literally 10 minutes to do an application, where sometimes people are on the phone with the state or trying to do it themselves. And it takes them, well over an hour. But so these are the people you'll meet with. I'm actually a backup to them. So if they're swamped or whatever the case is, I can do applications for the team too. So if you said, hey, I got somebody that needs health insurance, I usually would give it to one of the reps. If the rep is too busy, I will come on site and just do the application for them. And it literally takes me longer to get on my application, the actual website, than it does to do the application. It is a very fast process if you know what you're doing. The other thing with MFE and with all the plans, and this is just, remember this if you can, the MFEs or facilitator enrollers, we are all neutral, meaning I work for Excellus, but you don't have to pick Excellus. So if a plan tells you you need to pick Fidelis because we work for Fidelis, that is inaccurate, and that's a very big penalty if they do that. So from our standpoint, and from all the plan standpoints, it should be, we're neutral and we're here to help you find the best coverage that you need despite what plan you choose. Because at the end of the day, that's what we're really here for, is to help people find insurance and get enrolled into a plan and make this process as less stressful and less confusing as possible. Excuse me. So next thing is annual renewals. So every year you have to do a renewal. And again, what they do is they pull it based off of your income. If something's changed, you got a job. So they'll ask to update your application. And then sometimes they may change your actual plan. If you're somebody who may have had no job and then you find a high paying job, they may change what you're eligible for through the marketplace. But you will get a ton of different literature about it. You'll get calls from robocalls from New York State. You'll get calls from whatever health plan you choose saying it looks like your renewal is ready. The MFEs will also call you to try to do your application, because when you meet with a facilitator and enroller, your application is on their dashboard. So it means that they have access to your account at all times. So if you have a renewal coming up, we can see that. And then it tells us that, okay, Susie Q is getting ready to renew in January. Let me call her now to see where we're at. And that way you don't have a lapse in coverage. If you don't do your renewal, sometimes the state will auto renew you, meaning they'll just kind of give you the same plan as you had in prior years. That's what they've been doing right now because of the coronavirus. But if you're somebody who doesn't or do your renewal, you will have a lapse in coverage, and therefore your plan will end. But we do everything in our ability to make sure that nobody falls through the cracks and everybody has the coverage they need.
Hey, Mike, a question just popped up.
Sure.
One teacher said, I have a student with this plan, but is having an issue getting a second opinion for an injury.
Okay. So they're having an issue with getting an opinion because they can go to any office they want to. So did they go to a primary? Did they go to an urgent care? This is the stuff I enjoy, by the way. I enjoy trying to solve the issues. So I love the question game, by the way. Don't be afraid to ask questions. But do we know if the person went to where they were seen at?
I haven't seen an answer yet, so.
Okay. Because that's a big thing too. You know, if you're seen at a hospital, for example, they may say, you know, you have this wrong with you, but your doctor may say you have that wrong with you. So you can request second opinion, or if you went to your doctor and you feel like they're not giving you the right diagnosis, you can obviously go to an urgent care too. So they can also look at it as well. So you're not stuck in what that one doctor says. Or if you really think something's wrong with you, depending on what the severity is, because it could be a ton of different things where you may need a referral to go somewhere else. You can also look elsewhere for your doctor. But
he says went to second doctor, refused to see her because he did not do surgery.
So without me knowing what actually it was, because one of the things, let's say you have Medicaid, what it does is, let's say you're somebody who wants to have gastric bypass surgery. What they
Original knee surgery.
It's knee surgery? Okay. So, okay. I'll come back to the gastric bypass surgery too, though. But so he can't get a second opinion because they won't, because he didn't do surgery. So in that situation, with Medicaid, you don't need to you don't need to be linked to a doctor in a nutshell, I guess I should say. So he can call another office and say, here's what's happened to me. Can I be seen in your office for a second opinion? And usually they'll let you come in and do it. And because it's no different than somebody who, let's say, for example, has cancer and they go to one hospital and they tell them that they find nothing, but the person's still sick, and they go to another hospital and that is where it's discovered. There's usually, you can do that with your insurance. So it's really just trying to figure out what doctor is not in the network that you're in. So for example, if you're somebody who has Rochester Regional, you know, you may want to go to your University of Rochester. They're two completely different doctor's offices or hospitalizations that you can actually be seen by both.
The teacher said that's what she did, and everyone said go back to original doctor.
Okay, so then, yeah, without knowing the case or without knowing like the details of it, because I unfortunately am not the doctor's office, but I can just tell you that there are solutions to how to get around it, and that is what I would do. Or you know what, you go back to your doctor and you keep pressing on them. But if they recommended did they recommend that person's surgery and they didn't do it? Or I think what we can do is if you want to take down that person's information, I can give them a call. That way I can better sort it out. Because without knowing the whole detail of everything, it's hard to say, and I don't want to say the wrong thing either.
Mm-hmm.
But there's also too, on the back of his card or her card, there is a customer service number that they can call that will be able to break it down for them too and give them more detail, because the doctors put in their notes, the notes are able to be seen by Excellus, because ultimately your health plan has to improve the procedure. But you know, and this is where I was going with the gastric bypass. So let's say, for example, you want to do a procedure, it's gastric bypass, or let's say knee surgery. Before any health plan approves something, they will give you steps prior to that. So for example, you're somebody who has a knee problem and you want surgery, but they won't cover it. They may say, listen, we need you to do physical therapy first. Or if you're doing gastric bypass, we need you to go on these diets, try these pills, do these different things first. If that doesn't work, then we'll cover your surgery or your process. That's usually how it works with the health insurance world. So depending on where that person is with the knee surgery, or let's say gastric bypass surgery, really determines what the next step will be. And I can speak firsthand from this because I had a procedure done too, to myself. And I used to really sweat bad, like under my arms, probably too much information, but whatever. And I went through my insurance, and before I can get Botox in my arms, I had to do several different kinds of like different deodorants, pills, and none of it worked. So they finally covered my procedure. So that could be the reason why that person may need surgery and it's not getting covered, because there's other steps first that they want them to actually do before they cover any surgeries. So this is just a breakdown of the enrollment options. So again, so under 65, so 0 to 65, these are the plans that are covered. Enrollment is year round, so there's no time frame that you can't enroll. So continuous coverage. So MMC is managed care Medicaid, and CHP is Child Health Plus. So it gives you 12 months of continuous coverage. Sometimes the state's 12 months is really 9 months, but we'll do renewal enough time to make sure you have coverage for the whole year. It's just their time frames are really different. And really what we think is a year is different on their process. With health insurance, this is a big thing to know and understand. If you're somebody who is enrolling through the marketplace, there are several things you need to know as far as when to enroll. So if you're somebody who needs insurance, let's say January 1st, how health insurance works is there's the 15-day rule. So from this, so we're in December 1st. So December 1st to December 15th, we'll give you January 1st coverage. If you go to December 16th to January 1st, it's going to give you February coverage. So depending on when you need coverage is when you want to do your application. So some people like to hold off on when they do their insurance, but it really comes down to when you want the coverage. With Medicaid and Medicaid only, you can backdate your coverage to months you missed, or if you have prior medical bills, they will cover those for you too. The other plans listed will not do that. Okay, so we're going to kind of chat about the app that we have and the access to what it covers. I hope everyone can see this. This is actually a form that we have. It's actually front and back. So I just kind of did a side-by-side view so everyone can see what it looks like. So, and I'm actually going to drop these flyers off to the school. I'm just waiting for them to come in. So, and what this does is you download the app, so the Excellus BCBS app, and it kind of just gives you an overview of everything you have going on. Sometimes when you go to the hospitals or your doctor's office, they have what's called like My Chart, or Rochester Regional has something, it's called something different. What those do is it allows you to review your test results, make appointments, things like that. This is a similar process to that. This allows you to see your spending, what's your cover benefits, any rewards that you're eligible for. It'll help you estimate the costs of medical care, your claims, and it also helps you find a doctor and a dentist. So And then on the right-hand side, it kind of just gives you more a step-by-step on how to do that. So this app is great to have. It's on my phone because I'm the same way as everyone else. When it comes to finding a doctor, it's sometimes a struggle. So having the app, it's really laid out. It's really nice, a nice feature to have. Finding a doctor that you're looking for, though, you can just pop it in there versus calling the customer service number. But if you ever need more information on this or more information on the doctor's office, you can always call a customer service line and talk to them. Or you can also call the doctor's office itself and just ask them, are they accepting new patients? But usually this app will show you who's accepting it. Any questions on this app thing? I take it as a no. So what makes Excellus different from everyone else? So our mission and vision, so we're local, so we're in the heart of Rochester, so we're downtown. So if you need to, well, we're downtown regularly. As of right now, because of the virus, we're actually still closed down there. We can do members appointments, but it's a case by case. But we also offer full health plans for the entire life cycle of our members. So what that means is from the time you're born to the time you take your last breath or Medicare, you're covered without a worry. You'll always have us in your corner and covering your back when it comes to any kind of healthcare related items. And we also have what's called a commercial plan, which is insurance through your employer through work. We have a premier provider network of doctors. So 99% of the doctors in the area take our insurance. You never have to worry about not being able to go somewhere. Our customer service is top notch. Our member services is great as well. And the other thing too is we work with care managers. They're known as, the department's called Community Connections. They're actually like one of our counterparts to what we do. And what Community Connections does is they're the people who help you find additional services. So let's say you're somebody who needed housing, or if you needed food, or you're not sure of where to go. These are the people you want to work with. And what will happen is once you're enrolled in a plan through Excellus, a care manager will reach out to you and introduce themselves to you, and then say, any questions you have, you contact us and we'll help you through the process to make sure you're getting everything that you need from the health plan. Any questions? Such a quiet class.
Yes, I have a question.
Oh, yes, ask. Love it.
Okay. Essential plan. Do you have an income guideline for people can apply?
Yep. So there is a guideline. Yep. So it's actually, that's on one of my cool documents that I'm bringing over to you guys. But yeah, so there is a guideline. So, and if you want to, I can pull up a guideline for you at the end of the presentation, so you can have an idea of what it looks like.
Okay, that will be great.
Okay, because it's go ahead.
My second question is, what did people have an income last year, okay, and just got laid off this year, a month ago, okay? And when they go in to apply for the essential plan, they ask them for the income tax from last year, but that doesn't really apply right now that they are being laid off.
That's correct. So what happens is when somebody goes in to do their application and they lose their job, the state pulls the prior year income. Now, depending on if the state's updated with what's happening, you're not working, for example, you normally would just take it out of the application. And at the end of the application, it would ask you, it would say, we see a difference in income. Can you tell us why? And you just say laid off, stop working. And then what will happen is they'll ask you either sometimes to upload a letter, a separation letter. And that's why I mentioned getting a termination letter is key with this process. If you're somebody who loses their job or laid off, because that's your supporting documentation saying, I had a job, I'm not working, here's my proof that I'm not working. And then it'll usually take a day or so and they'll approve your health insurance once that letter has been reviewed.
Okay, good. Yeah, okay,
So,
that's good.
Did that answer your question?
Well, the third one is, do we need an alien number to apply for Essential plan?
You said an alien number? No. Yeah. So it depends. So for identity proofing purposes, if you're somebody who comes to this country, you sometimes should have some kind of supporting documentation. Sometimes people have green cards. Sometimes they have I-94s, but we can still do the insurance without having a card. And we can put, there's different things you could select in the application, still applying for it. There's just different options available for that. So it's really a case by case on what somebody qualifies for or will be approved for. The thing is, if they don't have any identification, they'll be put into what's called emergency service, emergency care, which means the only place they can go is the hospital. They won't be able to go to a doctor. So, and the difference between, and we'll use Medicaid for an example. The difference with Medicaids is you'll hear terms of straight Medicaid or emergency Medicaid versus managed care. Both insurances are the same, but doctors only take managed care Medicaid, which is going to be Excellus, MVP, United, Fidelis, things like that. So if you don't have a plan that backs you up, a lot of times most doctors won't take it and they will only tell you to go to the hospital because that's where that insurance is accepted at. Okay. Yeah. Thank you so much. You're welcome. And one of the things too that's cool about us that we can do is if you're somebody who has a benefit card and you're not sure of your insurance, I can look up your insurance through your benefit card to see when it starts, what you're covered for, if you actually have a health plan that's associated with you. Yeah. So I can do all that through what's called e-paces. So if somebody's not sure or they're just questioning it, I mean, I can help them through the whole process of it all. Okay, so let's say if I have a client who's strictly on Medicaid right now, but he's not sure if he's getting managed care or not, I can just call your office and you can look it up and see if he have managed care. Yep, you can call me and say, hey, as long as you have the consent of the client, I can look up what they have. So on their benefit card, it's called what's called a SIN number. Yeah. And it has 2 letters, 4 or 5 numbers, and another letter. And I can look it up in the system and it'll tell me what they're associated with. So if it says Susie Q has Medicaid, but no plan underneath it, that means they strictly have straight Medicaid. And it tells you where they got it from. Meaning, did they get it from the marketplace? Did they get it from social services? Was it just given to them when they came over or, things like that? Because, and I'll use an example. Let's say you're somebody who's incarcerated or you're somebody who is in prison and you're getting ready to be released. The state will give you straight or emergency Medicaid, but it's on you. You have 6 months to get a managed care plan. Because if you don't, for somebody who's, let's say, incarcerated, you have to go to classes, you have to go to treatments. That's why they give you that insurance. But to continue that treatment, you have to find a plan that's going to back you up or find somebody who will help you do it. That's why people go to DHS so much or they come to us because they want to continue their service. but they also want to make sure they don't have any bills associated with them. So that's why these plans are so nice to have behind you.
Okay. So I have a client who have a blue choice option.
Okay.
Managed care. And if they have billed that about a year ago and was not paid for, your office will handle this kind of problems?
As long as they're enrolled in the time frame. So, so they have blue choice option, which is our Medicaid. So how that works is like this. Sometimes what people don't realize is when I do your insurance, so let's say I did your insurance today, for example, your plan wouldn't start until January 1st with Excellus, but you do have coverage from 12/1 to 12/31, but it's only emergency Medicaid. So sometimes when somebody gets a bill, depending on the date of the service, depends on what insurance is going to cover it. Or the man. So they really have to look at when their insurance started and what did they have at that time. Did they have coverage at all? Was it a managed care plan? Was it just straight Medicaid? Because a lot of times that's where that falls into. And the other thing too is, was the office that they went to, was it in par with our insurance as well? That's the other thing. But usually if it's not in par and they get a bill, I would tell them to just submit it to their Medicaid on their SIN card, on their benefit card. And a lot of times they'll pay for it. They'll take care of the bill for them.
Okay. Thanks, Mike.
You're welcome. Any other questions? I like the question game. All right. So then I'll talk about this, our differentiators, appointment cards. So I'll drop these off too. Right now, I think I gave you a fax referral sheet, but these are just cards that we give out to clients to know when their appointment is, who they're meeting with, where it's going to be at. And on the right-hand side, it tells you all the things that we need you to bring. So if you have those documentations, you don't have to bring your birth certificate, things like that. If you're somebody who's not a resident, then possibly yes. But the biggest thing that we'll need is going to be if you have a social security number or social security card, any kind of ID, so your driver's license, and your income. That's all we really need to get this process started. But everybody's case is different. So just because I can help one person out and the state says, yes, this person's approved, doesn't mean the next person I help out is going to have the same results or same outcomes, because everybody's account is different.
Yeah.
So, and these are just a couple customer experiences that we had, that people call in and, give us their positive feedback on what they encountered and what's good about it. So these are like our stories, our happy stories. So, but you can look in the big one. It says, I met with a client and she switched from Fidelis Essential Plan to Excellus Essential Plan. She was so excited because her PCP did not participate with Fidelis as well as her surgeon that she wanted to see for over 2 years. So Excellus was given the authorization. The surgery is all set for February. She called and thanked me for all my help. So you can see the difference from plan to plan. And that's what I mean is, your network and the plan you choose is so critical to the coverage that you need. So if you're somebody who needs surgery, but Fidelis or MVP or United doesn't cover it, they're probably the last plan that I want to select then, if I know Excellus or another plan will authorize my surgery and are in par and network with the doctors that I use. So, but again, these are just, our stories of clients that are happy. There's so many of them. So, but we just chose these 3.
Do people have to, do you have a day that we have to change plan? Let's say if someone is in Fidelis and want to go switch to Blue Choice.
Yep.
Is there a certain month or certain time you can do that?
Yep. So that is what we're in right now. So let's open enrollment, which is going to be, it starts on November 16th and goes, well, it goes until when the state tells us not to, because every year they change the dates, right? It goes until the end of December, but a lot of times they'll extend it out to April. But the thing with Medicaid, especially, this is one of the things you got to know too. Let's say you enroll in a plan that's outside of open enrollment. You have 90 days to change your plan if you're not satisfied. After 90 days, you're locked in for that plan for the whole year until open enrollment comes. But I mean, as far as open enrollment goes, it's every year the same time frame, and that's your chance to meet with one of us or go on the marketplace and see what's out there, and review your plans, your selections, because every year people change, situations change. You could have been healthy in year 1, but now the second year doing enrollment, you need additional services, and the plan you currently have may not cover them all because of the network. That's when you want to change or meet with somebody. I would say it's best to talk to a facilitator and enroller about your situations and about what you should do. And each plan has their own facilitator and enrollers, so you could talk to them. You may see us all out at an event at a table. You may see it where it says Excellus on a tablecloth. That's us out there making the community aware that, hey, we're here to help you. So if you have questions, you're not sure of something, reach out to us.
So we have someone who cannot speak English and he wants to change his plan.
Okay.
Yeah, so I was going to make an appointment for him to see one of your members.
Okay.
You can help him out.
Do you know what language they speak?
He speaks Eritrean.
Okay. So we do have a translation line that we use. So the biggest question is, does that person remember how they got health insurance? Was it through the county, or was it through Department of Social Services, or was it through, did they meet with somebody like myself to do it?
Oh, okay, he got it through the marketplace.
Okay, so what we would do is we would call New York City Health and ask for a translator, and then we would have that app transferred to our dashboard, and then we could change it for him. Or if he wants to, he can always call the marketplace himself too, depending on how he did it, and just say, I have this plan, but I want to switch to this plan, do the translation service, and they can do it for him too as well. So they don't need to necessarily meet with us to get approved for insurance or enrolled. They can actually call the number to actually do it themselves as well if they want to. It's just when you meet with us, it's a faster experience. It's more person to person. It's personable. You have somebody you can connect with that can help you if you ever have questions.
Yeah, that's what he needs.
Yeah, when you call the state, you're just getting a random person. Right. So, but yeah, I mean, we do have, like I said, we do have a translation line, so we can always help them out there too.
Okay, I will get the number from Hannah.
Perfect.
Thank you.
You're welcome. And here's my contact information. So again, I do enrollments, but I'm more in the field. I'm more at events, setting up tables, working with the school districts, things like that to help families and children find the coverage that they need. So if you do send me a referral, like I said, what I normally do is I do send it to the reps first, or the FEs. If they say, hey, Mike, listen, I'm really swamped with open enrollment. Can you take this one? I have no problem doing it as well. So I just got to follow a chain of command from my end. But all my information is listed. Don't be afraid to reach out to me. Don't be afraid to ask questions. Like I said, I'm always here to help. Anything you need, like I said, just shoot me a call, shoot me an email, shoot me a text, whatever's easier.
Thanks, Mike. This was great.
You're welcome.
I'm excited to have these pamphlets and information on hand to hand out to people, just so you can hold something and see it. You know,
right? I agree. It's easier when you have a hard document in front of you.
Yeah.
Versus somebody trying to do a PowerPoint that's literally just pausing and talking. So it's something to follow along with.
Mm-hmm.
Questions? Nothing? All right, I'm going to pull up. Is this, let's see if I have it here. I don't think I do. These are the guidelines for, let's see.
Gotcha.
Hang on one second. I'm gonna give you a different document actually. This is my desk.